Hello. Welcome. Hey, everybody. My name's Dena. Nice to see you. Thanks for showing up. Yeah, feel free to put your camera on. It's awesome to see everybody. If you feel more comfortable, perfectly fine to have it off. We'll start in just a second here. We are going to start in a chair, so get yourself comfortable. Now and at any point during class, it is so important that you're kind of as your first priority is taking care of yourself. So if it doesn't work for you to be in a chair when the class is in a chair, please feel free to get on the bed, on the floor, whatever serves you. This is really a time for you to be dropping in to sensation and being open to what's here and being present. So yeah, we'll get started. By way of introduction, my name is Dena Saedi, and I've been working with folks with pain for the last 15 years. I am PRT certified, so it's been a really wonderful collaboration to bring my mind-body practices that I've been doing in pain clinics and yoga studios with individuals, workers' comp, to bring all of that and really combine it with pain reprocessing therapy. And today is going to be largely bringing that technology, that philosophy into our practice. So we want to go to work at teaching our brains that movements does not equal danger. Just a few pieces of direction before we get started. I want us to kind of have at the forefront of our mind that, so much sensation, pain, tension, anxiety, we are experiencing that through a lens of danger. And we want to at first acknowledge that we're likely doing that. And we want to use our breath to get resourced and make that shift to that lens of safety. So if you're kind of aware of PRT, then you know what I'm talking about. I'll give you lots of reminders along the way. But first and foremost, please take care of yourselves as we go. We're gonna go for about 45 minutes, and then we're gonna have a Q&A. And Daniela and Paulina are here. So you can put in the chat if you have a question that you're gonna want answered. At the end, they might be able to answer the question for you in real time. But yeah, so I'll be trying to give you modifications, but that would also be a great thing to bring to the Q&A at the end, like, this felt good, or this gave me a sharp sensation, but I felt it's exactly what my body needs. Whatever it is, just kind of take note and then bring it at the end. And I'll try to give you something that you can practice and repeat, which is the whole idea with changing the brain and making new neural pathways. Okay. So let's begin, shall we? Let's start to get grounded. And so I'm in a chair. Wherever you are at, I want you to feel all the pieces of your body that are touching down onto the ground. So for me, if you're in a chair, it's going to be the bottom of your feet. And if they're kind of dangling, come forward in the chair any amount. The seat, the sit bones, right? And then go ahead and close the eyes. Let's take 3 cleansing breaths before we begin. A cleansing breath is a big old inhale through the nose and an exhale out the mouth, making a sigh, getting rid of anything that does not serve us. And go ahead and keep those eyes closed as we start to tap into the force of gravity. Feel any heaviness at the base of your sit bones? Feel that connection with your feet on the floor. Notice if you don't feel that gravity working a little bit stronger on your exhale. And let's take a breath into the shoulders. And as you exhale, I want you to feel those shoulder blades dropping any amount. We'll do that a few more times. A lot of us hold tension in the shoulders. And if that's you, see if you can't create a natural rhythm, breathing into the shoulders and then softening. And if you happen to be someone who holds tension somewhere else in the body, the neck, the low back, the hips, wherever it might be, see if you can't direct your breath to that place. And feel any softening on your exhale. And throughout class, we're going to see if we can't kind of have an intention to notice anytime we feel intensity or pressure, anytime we might start to feel a little bit of pain. And we want to see if we can't pause and come to this mantra that we'll do now. As we inhale, we want to say to ourselves, I am. And as you exhale, say, letting go. Repeating with each breath, inhale, I am. Exhale, letting go. Just see how that feels in your body. You might be letting go of sensation, tension. You might be letting go of a thought, an emotion. Anything that doesn't resemble self-compassion, I urge you to let go of it. Perhaps feel yourself naturally breathing a little bit deeper. And at any point during class, as we're about to begin movement, I want you to catch yourself if you hold the breath. When we hold our breath, we're sending a message to the nervous system that everything might not be safe. So we're going to try to keep that breath flowing. Breath is your number one priority. Movement is number two. Okay, so let's begin to move a little bit. Bring your attention to your sit bones, feeling that heaviness, that gravity. And with your next inhale, I want you to hinge forward any amount. Just notice how that changes the presentation of your seat. And with an exhale, lean back any amount. And we're going to start to work with the hips and the low back, kind of spilling the hips forward with your inhale and spilling the hips back with your exhale. Good. Try to keep your neck and your mid back somewhat still, right? If they want to move naturally, that's great. For some of us, we might already have gone into a place where we're exposing ourselves to a stronger sensation. If you're someone that has discomfort or pain in your low back, notice what happened to the breath. Good. Always give yourself permission to take a little bit smaller breath. Hinge forward a little bit more now. And exhale back. Good. All right. Making any movement that feels good. Sit up nice and tall. Maybe roll the shoulders a couple times. Okay. So we worked a little bit with tension into the shoulders. A lot of us have tension in our necks as well. I want you to sit up nice and tall. Think about your alignment. Head right over shoulders, shoulders over hips. Full breath. Keep your chest lifted and bring your chin towards the chest. I want you to keep that breath flowing. You might notice there's a change in my breath. That's okay. Noticing the sensation along the sides of the neck. Good. And slowly come back to neutral. Might feel good to roll those shoulder blades back once again. Okay. And we're going to do a little extension of the neck. So sitting up nice and tall, I'm going to start to lift my chin, right? So if you feel tension here, feel free to take your hands, use your fingertips to support those muscles along the sides of the cervical vertebrae. and just kind of explore, how far can I bring my head back? Am I able to keep that lens of safety? This might not feel great, but that's okay. Is this a safe way to expose myself to a difficult sensation? Good. Just kind of decide how far you'd like to bring the head back and then come back to neutral. We're going to do a little flexion extension with just the cervical vertebrae here. So chin comes down. Good. And then in your own natural movement, head comes back. You might touch on some tension if you're someone that holds tension in the neck. Are you holding the breath? Can you keep it flowing? We want to slowly but surely learn how to meet difficult sensations with ease, with lightness. Good. And of course, use your fingertips to support your neck if that feels better. Okay, you guys, we're going to bring the whole spine into it now. As I lean forward, I'm going to reach my tailbone behind me, may or may not be using your hands. And as I lean back, I'm going to tuck my tailbone under. Good. So we're slowly moving from more of a subtle to more of a gross sensation. Only you know when it's too much. Nope, can't do that without feeling that fear or danger creep up. That's when you take a breath. Use your breath as a resource. Come back. Nice. Start to make these two movements a little bit bigger. Might bring my shoulders into it. Okay, so I'm going to let you guys kind of explore. I've given you a lot of instructions so far. Listen to your breath. Couple more. Little bit of change is not necessarily a bad thing. Not if you can meet it with that lens of safety. Good. Last one here. Maybe you exaggerate it. Touch the edge. And then come on back. Lift your heels. Really round the back. Tuck the tailbone. Good. And come on back to neutral. If it feels good, bring your hands to the shoulders and just make some circles with those elbows. We're going to get to the joints a little bit. Just kind of warming up the joints. Bring the hands together, interlace, and then find that full range of motion for your wrists. Good. And shake it out. Nice. So we're going to get into literally your full range of motion for your shoulders. I'm going to make a suggestion that if you have pain on one shoulder, to start with the shoulder where you have less pain, okay? So I'm going to reach my right leg out. I'm supporting myself here on half of my chair. And since I reached my right leg out, I'm starting with my right shoulder. You might start with your left side if you have more pain on your right side, okay? First thing, I want you to make sure that you are super solid in this chair. The feet are grounded down and one sit bone is grounding down, okay? And I'm just going to explore real slowly at first, but I want to notice where all those edges, how big, how wide of a circle can I make? I want to notice the moment that I feel that tension in my neck. And in particular, if you have any pain around this side of your upper body, this might be a much smaller movement and your breath might be the most important thing. So don't worry about what you look like, but get really curious and really open about how it feels. Okay, and when we do hit that point where, wow, my arm is back here and I cannot go any farther, that is the pain message from my brain telling me, do not go any farther. And that's a beautiful thing. My brain is protecting me. So just keeping that in mind. Maybe one more. I'm going to turn this into a side bend here. So reaffirm your tripod, everything grounding down. Keep your chest lifted and then reach the arm straight off to the side. This might be a new sensation. creating new neural pathways. Notice that moment things get a little bit intense. Can you meet that intensity with a different response? Good. When you've had enough, you don't wait for me. You come on out, slowly come on back. It's going to get a little bit of a neck stretch. Maybe make some circles. Let my shoulders come up by my ears. Good. And then I'm going to come back to neutral. Nice. Let's take a few round and flexion of the spine. Any movement that feels good. You want to slowly but surely open to the whole landscape of your body. Good. And then we'll move it on to the other side. Really grounding down here. Bring your arm out. Find that range of motion, a little bit less talking on this side since you know what to explore. Catch yourself in that moment that things feel a little bit more intense. Deepen the breath in those moments. Good. All right, and then we're going to set ourselves up strong, tripod. Lift that chest, lift that arm, and then straight off to the side. Getting really curious. This might be a position that feels really good. You might be able to tap into a positive sensation. Lean into it if that's the case for you. When it's time to come out, slowly come out, noticing the sensations of the transitions, and then moving that neck around any way that feels good to you. Good. And then come on back. Let's take a few more of those cat and cows, rounding the back, tucking the tailbone, coming forward any amount. Good. And a couple more rolls of the shoulders. We're going to get into a couple of twists here. I want you to bring your hands to your belly, and I want you to notice your belly expanding on the inhale and contracting back on the exhale. That's the direction we would like it to go. And then rest those hands on the legs somewhere, and just a little, I want you to exaggerate that exhale. So activate your abdominal muscles at the bottom of the exhale. So that little space after the exhale is complete. Okay. Set that off to the side. Inhale tall. Feel yourself grow tall on the inhale, exhale. Feel yourself ground in your seat. Nice. And then I'm going to turn the chest to the right side and start to work with bringing the belly in on the exhale. Taking a few breaths, exploring your twist. You might rotate the head, looking over the shoulder if that feels good. This might be where some of us are really feeling that intense sensation. Can we meet it differently? Good. Gently come on back. Nice. And round and flex the low back. Inhale tall. Let's come once again to that breath. Bring your belly in on the exhale. Good. Inhale tall once again, and then find the twist to the other side. Then take a few breaths here, exaggerating your abdominal strength, pulling the belly in right as the exhale completes. Then gently come on back, roll those shoulders back. Let's take that right arm out. We have a lot of external rotation for the shoulder. Let's get some internal. Bring it across the body, keep it straight. Keep the chest lifted. Feel that sensation along the outer shoulder, breath or two. Good. I'm going to turn this into a twist. Let both hands come off to that side and just turn the head, keeping your chin parallel to the ground. Come back to neutral, other arm across the body. Keep facing the chest forward as you breathe. Then we're going to turn that into the twist. The really light energy here. Turn the head. Good. And come on back to neutral. Ask your body what stretch, what movement would you like to make? We're going to take just a moment here and check in. So however you find yourself in your chair or your seat, go ahead and close the eyes. And I want you to ask yourself, what are the sensations that I'm feeling right now? And I want you to ask yourself if there is an emotion, a feeling that is here for you in this moment. And see if you can't detect where in your body can you feel that emotion that's here for you right now. And if that emotion has anything to do with criticism, any kind of mental noise that doesn't serve you, I want you to come back to the mantra. As you inhale, you say to yourself, I am. And as you exhale, letting go. And if there's only good emotions, then you're letting go of tension somewhere in the body. Noticing your ability to shift energy. Okay. All right. So go ahead, open the eyes. If they were closed, we're going to sit back in our chair for a moment, lift up one knee and start to roll out the ankle. We're going to get ready to stand, warm up some of the muscles in the lower legs. Okay. Then you're going to reach that leg out, feel something working. Maybe take a few bounces of the leg and then hug the knee in. Okay, other side, lift it up, roll the ankle both directions. Discover the muscles in your upper legs. And hug it in. Okay, curl all 10 toes under. And then look at those feet, place them about hip distance apart. They could be a little bit wider. And stand on up. Okay, so I am aware that some of us might have knee pain, discomfort, tension. Wherever you're at, you're gonna maybe knock on the door of the pain. We're not going full blown into anything that's gonna bring us into that danger, that experience through the lens of danger. But we're gonna start to bend the knees as you exhale and straighten the legs as you inhale. Okay, so get into your own rhythm here. A lot of us have the tendency when we bend the knees on the exhale to let the hips come forward. See if you can't reach the hips back, like you're halfway gonna go sit down. Inhale up. Okay, so this is the first time, you guys, that we're gonna start to move kind of on purpose through little intensity, right? We worked with range of motion with the shoulder, but now we want to find that fatigue, that heat in the muscles. At any point, you're going to take a break, go ahead and sit down. If you're somebody who's pretty conditioned with this movement, you might hold the squat. I want you to watch the breath slowly change. Use your breath as a resource to stay with that flowing breath, no holding the breath when things get hard. We're meeting sensation in a different way. You can keep it moving. Good. So kind of touch that intensity wherever you're at. If you've already found that place of intensity, by all means, we will meet you in the chair. But not until you found that your breath got shorter, your body temperature got warmer, your muscles got fatigued, that's when you're going to sit down. Good. And once you do sit down, I want you to come right back to your mantra. Inhale, I am. Exhale, letting go. Do that 3 times. Notice your heart rate. Notice sensation. What is here for you right now? What's happening inside? You need to take a scan of your body, locate an area where it feels pretty good. At least there's an absence of pain, but it's an area that you're going to be able to have really a positive, good sensation as you rest your attention on it for a few breaths. And think how you would even describe what that sensation is if somebody asked you. So if it feels safe, I want you to now locate a part of the body that maybe doesn't feel so good. Could be an area of tightness or tension or even pain. And if you're able to keep your attention there and maintain that lens of safety, I want you to come up with how you might describe if somebody wanted to know what exactly does that feel like. Is it pulling? Is it warm? If you're able to continue to move towards that sensation, keeping in mind that pain is a danger message from the brain, it learned too well how to make that danger message. But I'm moving towards that sensation with a different energy. Perhaps you could notice a shift in sensation as you breathe into that place. Just going to be here for another minute or two. Feel free to go back and forth between the place that feels nice and the place that doesn't feel so nice. So we're reminding ourselves that we are safe. And let's land in that area that feels pretty good. Really move towards it. Allow yourself to open to that positive sensation. Could be a place off the beaten path. We're going to incorporate a little bit of movement here. Let's come back to that early movement of hinging forward at the hips and tucking the tailbone any amount. Good. So just kind of warming ourselves up to make a move. Ask yourself, is there some move my body would really enjoy right now? Give yourself permission to take it. Sitting up nice and tall. Bring your shoulders up by the ears and just move the head all around. Okay. All right, you guys. So we are going to make our way to the floor. Doesn't need to be the floor, it could be the bed, a couch. Basically, we will meet up on our backs. If this is something you're not doing today, you can close your eyes, visualize you're doing the movement. If we're doing a movement down here that does not feel safe to you, close your eyes, visualize you're doing the movement. And we can give you specific modifications for the Q&A afterwards. But let's meet down here, hugging the knees into the chest. Give yourself a little rock side to side. And I didn't mention, but please make sure you're comfortable. If you need a little something behind your head, great. Gonna place the feet down if that works for you. You're gonna bring your hands to the belly. And then once again, kind of feel that natural movement of gravity. As we relax the shoulders, breathe into the shoulders, feel them soften on the exhale. Feel how you naturally kind of sink towards the earth. Keeping our awareness on the body, you might feel the front body expand with your inhale, and everything sinks and falls on the exhale. This is a place we can always come back to as we begin a practice. So let's start by discovering our abdominal muscles. Take your hands, bring them just inside your hip bones. And we're going to come back to that tucking of the tailbone on your exhale. So my knees are slightly apart, and I'm going to exhale, tuck the tailbone, feel something working beneath those fingertips. Inhale back to neutral, and exhale, tuck. Inhale, neutral. Good. 3 more, just like that. Really opening to these muscles maybe we haven't paid attention to lately. And then go ahead, come back to neutral, hug those knees into the chest. I'm going to keep hold of that right knee. I'm going to straighten that left leg. And I'm going to slowly bring that right knee off to the left till I find something interesting happening in my hip, in my low back. Noticing what's happening to the breath when my leg is crossing my abdomen. Notice where the breath naturally wants to go. We pay attention to sensation, and even when things get a little bit more difficult, can we meet it differently? With a little bit of lightness, go a little bit farther if that feels good. And then gently come on back. Good. Hug that knee in and switch. Other knee in, straighten the other leg. Same thing on this side. So what happens if we're doing movements that we haven't done before, haven't done in a long time, we might discover, wow, this actually gives me a positive sensation. So that's the kind of thing we want to keep in mind if there's a certain movement that we do today that gave you a nice adjustment, that gave you a nice open feeling. You want to come back to it. Design your own practice. Good. Go any amount farther if that feels good. And then come on back. Hug both knees in and make some circles with those knees. I'm going to place those feet down. I'm going to get the shoulders moving a little bit once again. So I'm going to inhale my arms up. And as I exhale, I'm going to bring my arms down. Do that a couple of times. You decide how far to go. Knocking on the door of the pain, no need to go in. It's a wonderful thing to find your edge. I'm going to get ready to come up to bridge pose here. So my heels are pretty close in towards my bum. And as I'm ready, I'm gonna walk my shoulder blades down. I'm gonna lift my hips up. So I'm gonna recommend not turning your head to the right or the left as you're in this pose. I want you to feel a gentle stretch, lengthening of the neck. If you've got a pillow that's in the way, you might want to try it without the pillow. So come down and remove it. So if this is feeling like you could be here for 5 or 6 breaths, I want you to keep lifting the hips up high. If it feels like this is not an easy pose for me, you're going to come down and then come back up. Okay, so we're workshopping bridge pose here. We're starting to build up the energy, create a little more of an energy of intensity here. So whatever that might look like, you might bring the arms into it. Good. Wherever you're at, watch yourself get a little warmer. Watch the muscles get a little bit more tired. If you're able to maintain that lens of safety, maintain that resourced breath, watch yourself respond differently. If you've had enough, you're relaxing on your back. You may be hugging those knees into the chest. Good. Giving yourself a little rock from side to side. Place the feet down, let the knees come together, hands to the belly. Just a few rounds of breath back to our mantra. Notice if that mantra, that message you send to yourself of inhale, I am, exhale, letting go, does that help bring you back to balance? Then let's go ahead and hug those knees in once again. We're going to find our edge. One more time here. So coming to figure 4, I got my right ankle crossed over that left knee. I'm going to take my right hand and push my femur bone away. I'm going to get right to that point that I cannot push it away anymore. And I'm going to deepen my breath. I want to meet that edge with a slower, deeper, softer breath. Good. For a breath or two, then go ahead and find your figure 4. Get a nice squeeze and come on out. We'll do the other side, kind of knowing what we're after here. No holding the breath. If this feels safe, no strange feeling in the knee. Go all the way as far as you can. I know this is safe. Is it intense? Yes. Is it safe? Yes. And if it's not, you back off. Find a version that is safe. And then find that figure 4 stretch. Good. Unwind, hug those knees in, place the feet down, arms out, and a little windshield windshield. Oh my God. Windshield wiper. I say it all the time, but sometimes you can't get it out. Good. Okay. All right, you guys. So from here, ask yourself, is there some movement my body needs to take? Maybe you want to hug those knees into the chest. We're going to just do kind of a final meditation. I'm going to sit up, but you are more than welcome. I recommend continuing that relaxing place on the ground, maybe replacing that pillow behind your head. And beginning with your mantra, inhale, I am, exhale, letting go. If the chair is more relaxing to you, then you're going to the chair. But we're going to start to tap into that natural force of gravity. Once again, all the parts of your body that are touching down to the earth, feel yourself sinking a little bit more on your exhale. want you to evoke an image of nature. Could be one of your favorite spots that you go in the woods, at the beach. But visualizing this place, feel that whole body sensation of serenity, relaxation. And feel your body, the weight of your body dropping towards the earth. We're going to walk through different areas of the body and just kind of scan the area, starting with the head, face, and notice where there might be any area of tension or blocked energy. And then bring that force field of gravity, just dropping any discomfort into the earth. Notice sensation in the neck, in the arms, the shoulders, any area of discomfort. Just feel it falling, grounding into the earth, relaxing away. And then notice your back body from your neck all the way down to your bottom, all along your back. Scan for any tension, blocked energy, and feel that dropping, relaxing back into the earth. Notice sensation along the torso, the solar plexus, and feel the area relaxing with the breath. Notice any heaviness along the sacrum area, low back, hips, pelvis. And then notice sensation all along the legs, the feet. Scan for any discomfort and feel the gravity just kind of taking it down. Let's come back to an area of the body that feels good, that feels pleasant. Feel yourself so open to sensation in that area, really moving towards it. Notice your ability to experience, to manifest that lightness. See if you can't tap into a little gratitude. You might bring to mind something or someone you feel grateful for, and see if you can notice that subtle energy shift of gratitude in your body. Okay. So this is where you ask yourself, do I want to stay relaxed here for a few more minutes? Do I want to take a stretch that feels good and make my way to a seat? What's going to serve you right now? Kind of staying with that attitude of self-compassion. And we're going to kind of segue into our Q&A. So make your transition, whatever that might be. I think I'm pretty punctual. And we're going to see if Anybody wants to personalize any of these practices, if there were questions in the chat that we can answer. I see Paulina's here.
Thanks so much, Dena. That was so wonderful.
Thank you. I hope you liked it.
Yeah, I saw one pretty good question in the chat. Someone asked about what to do when you have what is called mixed pain, right? A mixed presentation of structurally caused pain and neuroplastic pain, which is so common. First of all, I just want to say pain is necessary, right? It gets a really bad reputation, but it's actually a protective mechanism, right? It lets us know to stop doing something that's causing damage. But sometimes that pain is less helpful, right? When your brain generates pain when there is no physical threat. So, how do you know? How do you make that distinction between is the pain that I'm experiencing neuroplastic or is it structural? And sometimes it's not so black and white, sometimes it's a little confusing. So, my suggestion when talking about this, how this really relates to this movement class, if you start feeling worried about movement, I know that something that Dena said within her session was simply imagining the movement, right? What happens when you do that, right? When you're doing this imaginal exposure, something that we call, just really getting yourself used to the idea or the anticipation of doing something that might be scary, what happens to the symptoms, right? Do they come on even without movement? And if they do, maybe start right there, right? Start the rewiring of your brain without the specific movement and notice your response, pause, and communicate safety and explore the sensations, knowing that there's no way the pain is protecting you at that moment because you're only imagining movement, and see what happens when you do this and if you can achieve what we call a corrective experience while you're doing that. And then you can start integrating movement slowly, right? Start by movement that you know is safe, that's not going to cause damage, and doing the same kind of practice. Pause, communicate safety, see if you have a corrective experience, slowly upping the ante while collecting more evidence about your body until you know what's safe and what isn't. And almost using the pain as somewhat of a friendly guide as opposed to a fear-inducing drill sergeant or something like that. And so really doing it slow and taking it slow and letting your body guide you.
Yeah, I think
Pauline,
we talk a lot in pain reprocessing therapy about gathering evidence. So if you're saying, I'm not sure if this is damaging to my body or this has some sort of mind-body component, that's a great almost test for you to gather that evidence. If I imagine doing this and I don't actually move, does my pain increase? Does my pain come on? And that gives you insight into what might be going on and what might else be at play with this pain that you're experiencing in your body, which likely is fear, right? Or an anticipation of pain that brings on the pain alone, right? Or an anticipation of movement that amps up your anxiety. And you can really use that insight to help you with your treatment and understanding, okay, is it safe for me to keep going? Or do I need to pause and take this at a very graded pace, that graded exposure piece that we use in pain reprocessing therapy?
Yeah, and I would just add that I think sometimes it's hard for people to think that, am I doing anything if I'm imagining movement? Like, could that even do anything? But the fact is that science tells us that it is doing something. Um, they know that, like, I'll give you an example, that phantom limb pain, they figured out a long time ago that if they use mirror therapy, that this can help a person recover and get rid of phantom limb pain. But it didn't work for some people. So what they did is they had them imagine that they were moving the limb that wasn't there. And that was the preparation that they needed to actually take that next step. So there were people that were just stuck and they weren't getting better, but the imagining the movement is what took them to the point that they got rid of their pain. So yeah, there's lots of science behind it too.
absolutely. I saw another question about what if attention to your breath is something that feels scary, and that can be really common for people, especially if you've gone through a traumatic experience. Um, And so in that case, my suggestion is to find something else neutral or positive in your body to pay attention to, something that works for you. And if you can't find it, you can induce it, right? You can rub your hands together, you can rub your legs, you can induce a sensation that feels good and focus your attention on that instead.
Yeah, and that's the cool thing where kind of the psychology meets the movement, because also, and this is something we're open to if anyone has this type of question now, if there was a position, and maybe some of you do this when you go to sleep at night, because you want to get yourself in your most comfortable possible position, that does give you a feeling of pleasure, openness. It takes away, let's say you have nerve pain, it just kind of takes the pressure off your nerve that's giving you pain. Things like that, really setting yourself up, taking the time to get your body in that position that you can. And, we're not focused on the breath, we're focused on sensation in the body. And for that matter, you could be focused on a mantra, and it could be something that's just meaningful to you, something that you believe in. So there's different ways that you can incorporate the body with the thoughts.
And I think that comes up pretty often. In so many of these practices, mindfulness meditation, yoga, therapy, the breath is such a go-to often for the provider to use with their clients, but it does come up that the breath doesn't feel safe for everyone. And all that means is that you need to explore and find what authentically feels safe to you, which is really kind of one of the main pillars of PRT, shifting to this felt sense of safety and finding what feels safe in your body, which sometimes is just a trial and error, and doing some internal exploration and seeing what fits for you. But don't worry if the breath doesn't feel safe. It just means you have to find another kind of grounding pillar for you in your body.
And this idea of safety that works for you not only goes for what sensation feels safe for you, but also what messaging feels authentically safe for you, right? So a lot of times people, especially in this work, will constantly repeat over and over again, you're safe, you're safe, you're safe. But maybe that doesn't land for you. Maybe that doesn't feel authentic or genuine. So figuring out what is the mantra, like Dena said, or what are those safety messages that feel authentic to you? And maybe it's, this is temporary, or this isn't going to last forever, or I can do hard things, or I've survived this before, I'll survive it again, right? So just coming up with the messages that feel authentically safe to you. If any of you want to raise your hand and speak out, you can absolutely feel comfortable to do that also. We can call on you.
I also saw a couple of questions. This is being recorded. We will send out the recording to everyone who registered, so you'll have access to this after the class.
Sorry, I'm just reading through a couple of these. Someone asked if we have any thoughts about modifying for EDS or hypermobility. I don't have enough knowledge about that, but maybe Paulina or Dena.
Yeah, hypermobility, it's you have to relearn not going to your maximum, right? So for example, when we did that shoulder movement, your full range of motion, I wouldn't have someone with EDS do that, right? Because we want to relearn kind of, well, strength becomes really important, and awareness of muscles, and then activating those muscles. So it's I have a program and we go into joints one day, and you want to learn the best way to move your joints, right? And if you have hypermobile joints, then it's a little bit different. You don't go to your maximum, you're more focused on strength, and you learn new ways of doing some of the same movements that you have been doing. I actually did a little case study on a patient that had hypermobility, and it's actually on my website, just a page long. You can read about it a little bit. Yeah, maybe we can send that with the recording. But yeah, it speaks about that exactly.
And then what do you think of hot yoga? Someone asked, hot yoga and cold plunges for hypersensitivity.
Yes. So I work almost exclusively with the chronic pain population, and I do not recommend hot yoga if you're working with persistent pain necessarily. That said, some patients love it, and you should try trial and error if it makes you feel good, but the chance of re-injuring could be really a lot higher because your joints are so warmed up and the movements are a lot faster. It just depends, and hot yoga is quite an umbrella term, so it depends on what is the class, right? How fast is it moving? And then for the cold plunge, I'm not an expert, but I know that there's research and it's a little bit controversial, and yeah, so I don't personally do it, but I know it helps some people with joint pain.
Yeah. And I think my perspective on those two is really, what Paulina was saying before, with PRT, the framework is really how do we shift toward an overall sense of safety. And so doing whatever it is that makes you feel good and feel safe. So if hot yoga or cold plunging makes you feel good, it makes you feel safe, then I don't see necessarily why not. But yeah, I agree with what Dena's saying also. There's probably a lot more chances or risk in re-injury when your muscles or joints are really, really loose. So I guess it's a combination between the two. Yeah, Marjorie.
Sorry. I was just wondering if you could put your website in the chat and also let us know if you have regular Zoom classes like this so we could further participate.
We're gonna send a feedback form out to everyone, and we really hope that everybody replies with all their information because we're thinking about doing a class. And we'll put my website in the class, and I have my own programming that I do on my own. I have a 6-week program starting on March 11th. Movement for people that live with pain, creating a personalized movement practice. By the end of it, a lot of the pain science as well. But yeah, we'll definitely include that. Thanks.
Thank you.
And if you take a look at the email that was sent yesterday with the link to this class, that has Dena's website linked in it, the Sunset Pain School. So you'll see that if you just check the email that you used to log into the Zoom today.
Okay, any other questions? Yeah.
Yeah, we'll send the recording today. Thank you all for being here. I know we're at about time, but we want to thank Dena for facilitating this. This was so wonderful. Thank you all for being here and giving it a shot, and hopefully we'll be able to offer this more frequently if you're all interested in attending again.
Thanks, guys. Great to see everybody.
Thank you so much.
That was really good. Thank you. Thank you.
Thanks.
Very much.